Hiya, so this is day one after having my rhinoplasty with Dr. De Silva. So yesterday when I recorded, I was actually quite late for the surgery, so I didn't really have much time to explain why I wanted it done and what happened before the actual surgery. So for the consultation and the pre-op. So the first thing of why I actually wanted the rhinoplasty done was because I didn't like my side profile. I didn't like the bump in my nose, and I thought it was quite a bit like it sort of drooped down my tip, which I didn't like. I'll try and actually get you a picture of what my nose looked like before, just so you have more of an understanding. I don't know if you'll be able to see it. So as you can see, I had quite like a bump in my nose, and it sort of it drooped down a little bit. I just didn't feel very feminine, and I was really self-conscious of my nose. I didn't like sitting next to people. I didn't like when I was at work, like I have to sort of tilt my head because I didn't want people to see my side profile. It really got me down. So that's why I wanted it done, and I told you about wanted it done since I was 16 and that. So when I met up with Dr. De Silva first, this was for my consultation, and I first spoke with Jennifer, which is his practice manager. Oh, I think that's what she's called. But basically she just went through more about it, what I wanted it done, why, and then went through more information about it. And then I went through and saw Dr. De Silva, and he obviously went through like why I wanted it done, what I wanted done, and he then examined my nose, and he found that I actually, in my left side, it was more narrow than the right nostril, and he could say how that he could even it out so that I could breathe better. And also then, once that happened, we went into his office, and he basically done a digital image so that sorry, it's really hard to breathe, so that I could kind of see the final results of what it could look like. It's not obviously 100%, it could just show you what your nose could look like. And then we went through like what would happen, so we'd go for the pre-op and also costs. And then I went a week later to the pre-op, so that was more filling out. You had to basically sign like a form, initial it to understand what can happen. Obviously these sort of side effects, or they could be permanent, could happen, but they have to obviously say it to obviously cover themselves, because it's a very likely chance that it can happen, but obviously it can still happen to someone. It's not really like a 1% chance that it can happen, but obviously they have to put it down, which obviously was quite scary to read. But after all of that was done, and then I met Sasha, which is the nurse, and she basically like takes your height, blood pressure, your age, your height, and all that. And then I went to see Dr. De Silva again, talked through it more, asked if I had any questions, and went through it again of what will happen on the day. And then yesterday was my surgery day, so I was running quite late, so I didn't really have that much time. But basically I went and saw the sedation doctor, and he was very kind, very lovely. He settled you down very easily. I don't really like needles, and obviously he had to put a needle in my vein, and it was to put I got a bit confused. I thought that was the sedation, but it wasn't. It's like dosage of paracetamol going obviously into your blood system, so it kicks in quicker than taking a tablet. That was the only thing I found that day that was the only thing that I thought hurt. It didn't even hurt, it just sort of, I'm not good with these needles, and it made me feel really lightheaded and nauseous, so I had to lay down for a bit. After that, everything went quite easy. So yeah, then the next minute I was actually in the op theatre and lay down, and basically I was out of it within a minute. Just remember waking up, felt like 10 minutes. I didn't even know like it was done. I thought, because obviously it's sedation, so I thought that I was sort of waking up halfway through it, but because I could breathe and everything, so I asked like, was it done? And it was. I was a bit like, oh. And then, so my auntie and uncle picked me up, and I live quite far away from London, so it was about a 2-hour journey, but the journey was all fine. I mean, after the surgery, it felt more like discomfort. It hurt, my teeth hurt. I'm not sure why my upper lips hurt, but they felt quite like numb and like pressure, just a lot of pressure on them. And also around my nose here, I felt quite a lot of pressure, and I had a bit of a headache, but I didn't feel like nauseous or sick or anything. I felt obviously a little bit out of it from the drugs, but other than that, the journey was fine. In the evening, I managed to actually eat chicken and rice, which I didn't think I would be able to, because my auntie cooked out for me. I was going to just have soup, but I actually got through that. I was surprised I could actually taste the food. I thought, from obviously being so congested, I wouldn't be able to, but I could. It's obviously quite hard because I can't breathe, so you don't enjoy it. So yesterday I didn't actually have any bruising, but today it's come up just around my eyes. It only came up about a few hours ago. It's not that much, but I'm kind of hoping it doesn't get worse. It might tomorrow, might be more black and blue, but other than that, yeah, I feel alright. I just feel a bit stiff in my face. And obviously when you're walking and stuff, you do feel a little bit like lightheaded, so you do have to take your time with getting to like places. Yeah, you don't actually have to wear this, by the way. It's just in case, like obviously for first day, some blood, like it oozes out, some liquid, so obviously it stops it from dripping down. I like to wear it just because I feel more comfortable wearing it. I just feel like it's more safe. But yeah, other than that, I feel fine. What else? Yeah, the only other things is I actually looked at another video of someone having a rhinoplasty, and they said that obviously from where you're breathing out your mouth, your lips get really dry, and that was really good advice to get like some Vaseline, because they do get really uncomfortable, chapped, so it's nice to have a tub beside you. What else? Also, just to prepare yourself for, so get all your medications beforehand, because that's a lot easier. There is actually a lot of medication that you'll be taking, but it is a lot, but you you just take it all in one go anyway, so you do remember taking it. Oh yeah, so last night was obviously the first night of sleeping upright, so it was okay. Obviously it was quite uncomfortable because it's weird to sit upright, and I put some pillows beside me so I didn't roll, even though during the night I was sort of like that, but then I put a pillow like here so I could kind of lean like that. I wasn't going to take one of the tablets that relaxes you and makes you fall asleep faster, because you only get 2, but I thought obviously the first and second day might be the hardest, so I did take it because it did take me up to an hour to get to sleep, but once I took that, it was all fine. I went to sleep and didn't wake up till the morning, so that was good. Trying to think of what else. Yeah, I mean, I don't feel that swollen. Obviously around here I do, not quite. Yeah, like, obviously you can't like move your face that much, and it does hurt to smile, so yeah, if anyone tries to make you laugh, it does hurt. But yeah, other than that, it seems it's much easier than I thought it would be. This is only day 1, but yeah, so I'll update you tomorrow, okay?